Hello, sir. Now it is visible.
Slide is visible, sir.
The slides are moving, sir.
It is not full.
Shubham,
Yes, sir.
Trupti, TRUPTI,
The slides are moving, sir.
TRUPTHI.
Yes, sir.
Yes. She has logged in through her laptop. TRUPTHI. Correct.
Yes. Made her
She has logged in through her laptop.
made her co-host.
Okay, fine. Fine, perfect.
Thank you, Shubham.
I'm receiving voice from someone's system. Please, fine, perfect.
Thank you, Shubham.
Pradeep sir,
Hello, sir.
ನಿಮ್ದೇ ವಾಯ್ಸ್ ಓಪನ್ ಇದೆ.
Okay, sir.
Okay. One humble request to everyone, whoever is not speaking, keep yourself muted so that there is no chance of echo from any end.
Stream हो रहा है ना? Pradeep sir, can you try moving your screen? Down the end in your right side, there is slide where you can click on the last icon. It shows that presentation mode. So you will be able to make it to presentation. I request all the faculty members to join the meeting with your own name or college code. So if in future you need something to track, we should have a record with us. So it will be easy for us to provide information. I request everyone to join the meeting with your own name, your college code or your college name. Yes, sir, it is visible and moving.
Thank you, sir. Thank you.
Thank you so much. Can you unshare screen for a time being so we can start the meeting?
Shubham, this is Dr. Naveen here. Can I just check my slides?
Please, sir.
Yeah.
Okay.
Just a second, I'm doing it. It is coming, right? Shubham? Slides
sir,
are
it is
Yes,
visible.
yes, it's
Yes,
visible
okay.
yes.
moving.
Yeah, thank you. I'll
Yeah.
just exit. Yeah, thank you.
We will be starting in a while. I request everyone for bit cooperation.
President sir has joined.
Has not joined, sir. Waiting for
Okay.
him.
Okay.
I think President sir has joined. Shubham sir.
Yes, ma'am. I request Dr. Tripti
Tripti madam, you can.
initiate the meeting.
Yes, sir. Shall we start?
Yes, please.
Yes, ma'am.
Om Dham Dhanvantariye Namaha. Very good afternoon to all. So, a very warm welcome to all
Thank you.
participants and guest speakers to the day 3 of Faculty Development Program. So, session 5 and 6. So, to begin with, we have with us today the President Board of Ayurveda NCISM, Dr. Allama Prabhu Gudda sir. He'll be giving opening remark. So with that, we will start our session today. Over to you, sir.
Okay, thank you, madam. Very good afternoon. I won't take much time. It's an historic event because we have seen the numbers. In Zoom meeting, the number is 1,000 and in YouTube, it is 7,800. So as per our NCSM records, this is the third highest views. First two were regarding Prakrutika Parikshan. Prakrutika Parikshan, it's a mass program. This is a class program. And as far as class program from NCSM, this is the highest views, 7,800. And one more thing is not a single college has left this program. So all the 573 Ayurvedic Medical College teachers have attended this one. So for that, I will congratulate all the teachers for this initiation. And one more is this is the first program. This is the first of its kind. And one thing is, so next after 10 days, we are taking second initiation for the PG staff. So for PG staff, one is the teaching method technology and research methodology. It's a common program for all the PG teachers. Teaching methodology and research methodology. Teaching technology and research methodology. This is common for all. And second is the domain specific FDP is for individual subject. So after 10 days, we will do it. And one more is we are planning to involve the institutions also. So in collaboration with the NCISM and institutions, why can't we conduct FDFAs? So that is also in our program. And one more is this is all were online programs. And next is the Utkarsha. The Utkarsha, it's an offline FDP program. So it is zone wise in Karnataka, in Maharashtra, Madhya Pradesh, Uttar Pradesh. So likewise, zone wise, we will arrange the Utkarsha, which is offline training program for the teachers. This is one thing. And one more is so next after 2 days, after 2 days or 3 days, as our staff asked to share asking for to share the PPTs of this program. So we will share the PPTs within 2 to 3 days. And one more thing, just I would like to bring to your notice that after 2 days, we are sharing one separate mail ID for all the teachers. So it is for sharing of your success stories. For example, in the last 1 month, we received 4 to 5 mails from the teachers that they have got the patent. Kindly inform all the staff. So our we will create one separate mail ID. So whatever your success stories, you please share to that separate mail ID. For example, if you are getting a patent, you are getting some staff are getting 10 lakhs, 12 lakhs, 8 lakhs from Indian knowledge system. So like all the success stories at some of the Ayurvedic colleges, they are inaugurating a hospital of 15 crore, 20 crore, 50 crore. So whatever the success stories, you have to share to that separate mail. This is all thing. So this is a teaching is a second time learning, as we know. So anyhow, all the teachers were attended this FDP. For that, I thank all the teachers from Ayurveda, Unani, and Siddha colleges. Okay, thank you, and over to Madam.
Thank you so much, sir, for your opening remark. So with this, we will move on to our actual session 5 of day 3, 23/4/2026. The topic is Assessment Methods in ASUS Education, Part 1 by Dr. Pradeep S. Shinde, sir, Professor and HOD, Department of Shalya Tantra, KHER Sri BMK Ayurveda Mahavidyalaya, Belgavi. So here is a small intro about sir. He has a teaching experience of 18 years published 42 articles in reputed journals, presented 23 papers, chaired 4 sessions in different national and international journals. He has given 6 radio talks, 2 TV talks. He has given talk in faculty development program as such. His contribution in educational methodology includes he has prepared a systematic teaching modules, prepared booklets and implemented SOP by the name Update Shalya Tantra, which includes policies and procedures of NABH. He has developed a clinical skill lab, which is the first of its kind in Ayurveda institutes in India. He has been awarded with Best Teacher Award 2021 by National Sushruta Association in India at Shrutayu 2022, organized by Parul Institute of Ayurveda, Sushruta 2017 by APNA, that is Association of Ayurvedic Professionals of North America, and many more. Now, let us welcome Sir for the session. Over to you, sir.
Thank you, madam. Hello, madam. Am I audible?
Yes, sir. Yes, sir, you are audible.
My slides are visible.
Yes, sir.
Are they moving, madam?
Sir, can you change the slides?
No, it's not moving, sir. मैं करता हूँ. It's moving now.
Yes, sir. Sir, shall I start?
Yes, sure, sir.
Good afternoon, everyone. I welcome you all for third day faculty development program, Yukti, organized by NCSM. Today we'll be discussing on assessment methods. So myself, I am Dr. Pradeep Shinde, Professor and Head Department of Shalatandra, Kair Sri BM Kankanwadi Ayurveda Mahavidyalaya, Belagavi. Before starting my presentation, I want to thank all the office bearers of NCSM for providing this opportunity. Often it is seen that the teacher is very much satisfied or contented regarding his way of teaching. Unfortunately, during the time of assessment, it is seen that the learners fails to answer the answers properly or perform poorly. Now, the same teacher gets disappointed and goes away from his responsibilities and he becomes disheartened and then starts telling that it is and he puts blame on the students. It is not his fault, but it is fault of students. This is the time for introspection, time to reassess our knowledge, skill of assessing our learners. So assessment plays a very pivotal role in teaching learning process. So today we'll be discussing regarding the same, that is assessment methods. So objectives of this today's session are, at the end of this session, faculties are able to know assessment principles, understand the different tools of assessment, understand the importance of formative and summative assessments, choose appropriate tool for assessing selected topic, choose appropriate tool for formative assessment and summative assessment that assesses COs and POs which are mentioned in the curriculum. Now, introduction. As I told you, learning is a cycle. Many times this happens that a teacher thought of one topic and he forms his own objectives for that topic and deals in the class. After that, whether students have learned the topic in a full way or not, it could be only assessed by taking the assessments. And once he assesses the students and he understands that there are some faults or some problems in feedback from the students, and again he reforms the objectives, again reteaches. So learning is a continuous process wherein assessment plays a very, very important role. So begin with the assessment. The definition of the assessment can be, the term assessment refers to wide variety of methods or tools that educators uses to evaluate, measure and document the academic readiness, learning process, skill acquisition or educational needs of students. Other definition could be a process of defining, designing, collecting, analyzing, interpreting, and using the information to increase student learning and development. So assessment obviously helps to assess the students of their learning progress and to take a feedback and remodel the teaching methods. So that is the importance of assessments. So assessment principles. To know the assessment principles, you need to ask 3 questions as a teacher. Why do we assess? What do you assess? How do you assess? So what do you assess? We assess measuring the learning outcomes of the students. We do assess for certification, whether he has passed or failed. We do assess for monitoring the program. We do assess for taking the feedback from the students, whether the methodology which was adopted was good or not, or any improvisation is required. And what do you assess? We assess the learning component under 3 headings are 3 domains: knowledge, skill, and attitude. In knowledge, we assess basic sciences, behavioral sciences, clinical sciences, whereas in skill, we assess clinical skills, communication skills. In attitude, we assess professionalism, interprofessionalism, and ethical. So how do you assess? The third question is, how do you assess? We do assess with the Miller's pyramid, where, as you know, Miller's pyramid has 4 steps: knows, shows how, knows how, and does how. And each teacher wants his students to be, they should transfer from knows to does how. So the most highest level of Miller's pyramid is does how. So in medical education, we feel that all students of medical students should perform the given the task. So to implement this, there are different tools for different levels. Say example, to make your students knows how, you can use MCQs, essays. To shows how, you can use clinical text based MCQs, modified essay or viva. Knows how, you can use the tools like OSCE, simulated based patients. To assess does how, portfolio, direct observation, logbook, 360-degree evaluation, mini CX, and DOS. So as a whole, assessment tools could be categorized into these 4 categories: knowledge-based, skill-based, attitude and behavior-based, and scientific understanding. In knowledge-based, written test, long essay, short essay, MCQs, viva, will come. In skill-based assessment tools are long case, short case, OSCE, OSP. Attitude and behavior, to assess this, you need to have DOS, peer assessment, self-assessment, scientific writing, projects, clinical reviews. These are the different methods of assessment tools according to different domains of learning. So as my topic was, what is assessment and what are the types of assessment? So here we will try to understand what are the types of assessment. Assessments are broadly classified into 2 ways. One is formative assessment and summative assessment. Again, formative assessment is of 3 types: session assessments, periodic assessment, and turn assessment. While as in summative, there are again 2 types: theoretical assessment and practical assessment. Here, session assessment is not included in NCSM. Now, there are different reasons for that. We'll deal it later. Session assessment means a session could be a 1 hour, 2 or 3 hour, or within a day. You are speaking on a topic and you are assessing that could be called as session assessment. And we'll try to know regarding periodic assessment, turn assessment, theory, practical in further slides. So what is formative assessment? Assessment carried out during the instructional process for the purpose of improving teaching, learning, and feedback obtained to be used to make adjustments so as to form a new learning. Or the other definition of formative assessment could be assessment that particularly intended to provide feedback to the learners or the teachers on the performance to improve or to accelerate the learning process. So formative assessment is also called as focused assessment. So what is formative assessment? It is taken on the very small topic, and it is a continuous process wherein we will be going to assess, when you will take a feedback from the students and we make adjustment in our teaching learning process. And another name of formative assessment could be focused assessment. The purpose of formative assessments are to determine how well students have learned, to serve as a feedback to the students and teachers. Characteristics of formative assessments are frequent test at the regular intervals, small content area. So your formative assessment will be taken frequently or with the regular intervals for a very small content, gives immediate and descriptive feedback to the learners, teaches students to self-assess and set goals, used to monitor students' ongoing process, assist teachers in modifying their learning and teaching methods, involves goal setting, monitoring process, and reflecting on the results. Now we'll come to summative assessment. So definition of summative assessment is assessment done at the end of the semester or year to know the competencies or achievements of the students is called as summative assessment. So summative assessment is an assessment which is done at the end of semester or year or completing the complete syllabus. That type of assessments are called as summative assessments, generally used for making pass or fail decisions. So obviously summative assessments will give a decision like pass or fail, or it may grade. The purpose of summative assessments are to measure the level of achievement of learning outcomes, to determine whether students is competent enough for certification. Means he could be certified and sent into a layer world process to practice. So, so you are assessing the complete competencies at the end of the year. That is called as summative assessment. So characteristics of summative assessments are: it is infrequent, means it is not conducted frequently, covers all the contents of prescribed syllabus, broad range of difficulty levels, results are in the form of pass or fail or in the single score, little scope of meaningful feedback to learner or teacher. So usually at the end of summative assessment, you can take a feedback, but you can't re-put it into a teaching methodology because the students will pass out and go to some higher educations. Now we'll try to understand difference between the formative and summative assessment. So in formative assessment, assessment is for learning, whereas in summative assessment of the learning. In formative assessment is done to detect specific strengths and weaknesses. Summative assessment is done to determine overall achievement of the student. Formative assessment is done for improving the teaching and learning process because we take a feedback and we rechange our teaching methodology. So it is called formative assessment. In summative assessment, we measure the competency at the end of the course. In formative assessment is ongoing process. Your summative assessment will be taken at the end of the course. Learn through the feedback and practice in formative assessment, where grades will be given at the end of the course in a summative assessments. Next comes another type of assessment that is called internal or continuous assessment, or it's also called a term test. I'll repeat. It is the third method of assessment, or you can say it is a type of formative assessment. It is called internal assessment, or it is also called as continuous assessment or a term test. The assessment conducted by a teacher without an external supervision or any supervision from other university based on day-to-day observation of the student is called as internal assessment or continuous assessment. Continuous assessment is throughout the course. So your continuous assessment till the completion of the course, that will be continued. It focuses on process and amount of learning. Various skills like competencies can be tested, which are very difficult to test in formative assessment and summative assessment. So in formative and summative assessment, you don't have time to examine other competencies of a student, but you have ample of time in continuous assessment or term assessment so that you can address the different competencies of the students. Continuous assessment is an educational policy.
Hello.
Hello?
Hello.
Hello? Hello?
Yes, sir.
Is there any problem, sir?
No, no.
No.
Somebody
You
is
can
speaking.
continue, sir.
Okay, thank you, madam. So I was there with a continuous assessment. The continuous assessment is an educational policy in which students are examined continuously over most of the duration of their education. So it is one of the educational policy That too for medical education or higher educations where the internal assessment or continuous assessment is must. So why internal assessment? During the training, the health science students, they develop psychomotor and affective skills. Assessment of these skills is more valid if they're done on continuous observation. In many universities, it is mandatory for UGs to pass their internal assessment before university exams. So term test or internal assessments are kept in NCSM. So it is one of the continuous method of assessing wherein we do assess psychomotor and affective skills. So limitations of summative assessment examinations are emphasis on product learning, practical skill cannot be evaluated, no emphasis on assessment of attitude, communication skills, ethics, and interpersonal skills. So characteristics of internal assessment are, it represents a continuous awareness of the teacher about knowledge and development of his students. It emphasizes observation of the progress of the students to make corrective actions as and when required. It provides the knowledge of achievement and progression. It deals with the abilities that cannot be tested in summative examination. As we are the teachers, we must identify the abilities that we want to develop in our students in our respective subject. If you know, in QCI, we do develop certifiable skills or competencies. Example, as I'm a charlatan teacher, I say I have developed the competencies in my department as a UG student should and must perform dressings of the wounds. He should able to do parasurgical procedures. It could be Agnikarma, Rakta Mokshana, or different types of Rakta Mokshana very competently. He should do CPR very competently. He should do urinary catheterization. He should do a small suturing. So these are the competencies I want my students to be imbibed at the end of the course, and they should be very perfect. So such type of competencies could be very well addressed only in case of internal assessment or the continuous assessment or in the term test by different methods of assessment that will deal in the further slides. So characters of designing the process of internal assessment are focus on process of learning, gives priority to psychomotor and affective domain. This is very, very important. It gives priority to psychomotor and affective skills of the students. Involves all the faculty members of the department. So usually in internal assessment, you need a maximum teachers to assess the students. Results are immediately made known to the learners and discussed with them to make the process learning better. So if they made a mistake, then you can immediately tell them this is the step you are missed and this need to be improved. So student will never miss that type of the skill or competency in his future. So advantages of the internal assessment or continuous assessments are, they can be divided into two ways for students and for the teachers. For students, feel secure by knowing his process of learning, to identify the deficiencies and mistakes and to make measures to improve. For teachers, assess the students in all the domain, able to make corrective measures, then and then only. Keep a good reports with the students. So these are the advantages of internal assessments or term tests. So if you see this slide, in NCSM has followed in all the phases, there are three terms, first term, second term, and third term. In each term, you have three periodic test and term test. In the second term also, it follows the same. There will be three periodic tests and a term test. And in the third term, you have three periodic tests, but there is no any term test. But instead of that, you have university exam. So here, three periodic tests are formative types of formative assessment. Even term test is a formative assessment, but you can name this as internal assessment or continuous assessment or term test. And at the end, the university exam, whatever we take, where external experts will come from different universities, that could be called as summative assessment. So in the syllabus 6.C table, this tells regarding the calculations of the summative, formative and summative assessments. As you know that there are three terms, and as I told you, there are three periodic assessments in each term. So here the table number A3, B, C will give you ever the periodic assessment should be taken for 15 marks. So you're entering in the first term 15, 15, 15, and in the D column you are making average of 3, and you are converting this whatever you are getting in the D that you are converting into 30 marks by multiplying with the 30 and dividing by 15. Then you are writing the whatever the student have got in the term test, which is taken for 100 marks, and you are converting that 100 marks into 30, and you are writing in the F column, and in the G column you are adding the average of the periodic assessments and the term test, and you are taking the average of that, and that the first and second term you are adding, and this will be taken as the internal assessment in the final scores card of the student. So this is much more easier. You need to remember something. What I mean to tell is, so your periodic assessment should be taken for 15 marks. Maximum will be 15, and you need to write in this column, take the average of that, convert them into to the 30 marks, and take exam of term test ever for 100 marks and convert that marks into 30 marks and add them. Then take average of that, add this, and this will be the internal assessment in the for a final scorecard. Now, the second part of my presentation will be various methods of formative assessments. So now we'll see different methods of formative assessments, which could be, which are very, very important in ASU teaching. So in the syllabus, table number 6D will tell you different methods of periodic assessments. See here, NCSM has told this periodic assessment means you need to conduct these all different types of assessments in different PAs. It should not be repeated, and it should be based on the component of the teaching, which assessment suits for what. According to that, you need to take different types of PAs. If you enlist here, practical, first one is practical or clinical performance, viva voce, MCQs, open book, summary writing, class presentation, problem-based assessment, then OSCE, OSPE, mini CX, direct observation procedures, case-based discussion, and so on and so forth. So there are many types of tools for periodic assessments are given, and we need to follow them. So in my further slides, I'll be addressing one by one. So here I tried my level best to classify different types of different tools of assessment in according to domain specific. So in cognitive domain, you have MCQs, SAQs, and LEQs, oral viva, open book, application-based questions, seminar, general club, micro teaching, clinical video cases. In psychomotor and affective domain, simulated or standard patients, checklist-based assessment, case writing skills, DOPS, OSCE, OSPE, general structure or structured viva voce, mini CX, law books, and portfolio. So among these, I'll be highlighting the highlighted few tools I'm going to discuss, and remaining all will be discussed in the next session after my presentation. So first, the tool for assessment is clinical video cases. These are very, very simple. The first one is clinical video session. Clinical video cases provides a virtual insight into a real world scenario, testing students regarding diagnostic and decision making. So here, what is the structure of this tool? Showing the videos of a patient or a doctor-patient conversation and asking the students to diagnose the case and probable treatment. So what we are going to assess? Diagnostic and decision-making skills. And example, showing the video of limping gait and asking the students to diagnose the case. So you can see in this this video, the professor is showing a typical gait of a disease. So almost all the teachers might have noticed that this is a case of Parkinsonism, and here we are going to assess whether students is able to diagnose this gait and what are the treatment modalities could be given for this case. This is how we assess in case of clinical video cases. The second tool I'm going to discuss is seminar. This is very commonly used in medical field, wherein presentation offers multifaceted assessment platform. The format depends upon the subject and the topic. Whatever the teacher can decide whichever topic is required for this seminar. Assesses depth of the knowledge, organization, and presentation skills are assessed by rubrics. You have typical rubrics for assessing the seminar. With that rubrics, you are going to assess the students. By making such type of tools or assessing methods, you can improve the verbal communication, organization, public speaking abilities, and fostering the well-rounded development of the student. Now, this is the rubrics for assessment of a seminar. It has three main categories like content and knowledge, organization of the structure, and presentation skills. Here, again, each category is divided into sub-criteria. In content and knowledge, the first criteria is demonstrate in-depth understanding of the case and related medical conditions. The second criteria is providing accurate and detailed patient history, diagnosis, treatment, and prognosis, integrates evidence-based information and recent researches, which comes under category 1. And second category is organization and structure. Here we are going to assess information in is present in a logical sequence or not, clear introduction, body and conclusion of the presentation, transitions between the one section to other section very smoothly with enhancing the understanding. And the third category is presentation skills. Here the different categories are maintenance of eye contact with the audience, speaks clearly and at appropriate pace, uses body language effectively, maintains time as well as without rushing or exceeding the time limit. So these are the criteria for assessing the seminar, and you can do whether students are demonstrated needs improvement, satisfactory, good, excellent, or you can one more column you can make it and put a marks for it, and with that you can assess whether student is doing good or not in this type of assessment tool. Then the third one is micro teaching. Micro teaching is a teacher training technique that helps postgraduate students to develop better teaching skills. So usually micro teaching is a teaching method is used in the PG students, but it is nothing bad if you adapt this into UG students also. Here we are going to assess knowledge, communication skills, professionalism, and attitude. Again, to assess this micro teaching, there are again rubrics wherein there are a set of skills that need to be assessed. Set one is set of induction, planning, presentation, pupil participation, use of AV aids, closure, and overall effectiveness. Again, these skills are again divided in set induction, arouse interest in the beginning, specify the objectives of the presentation in planning, organizing material in a logical sequence or not, use relevant content matter or not. In presentation, use specific examples to illustrate the main idea, use non-verbal eyes contact. In people presentation, allowed questions from the students or not, asked questions or not in the while presentation, AVAs, whether he has used appropriate AVAs or not. And in closure, summarize most of the important parts at the end of the session or not. So these are the tools with which you can assess your student whether he is doing micro teaching good or not. Here also you can give a marks for each criteria and you can assess the students. It's very, very simple, but you need to have these sets of rubrics for assessment of micro teaching. Then whatever till I discussed, this comes under the cognitive domain. Now I'm going to discuss regarding psychomotor and affective domain tools which are used for assessments. So fourth one is checklist based assessment. It is very simple. Checklist based assessment provides a structured evaluation criteria for various skills or tasks. They offer systemic way to measure the performance against predefined standards, ensuring the comprehensive coverage of essential competencies. The structure is preparing the checklist beforehand based on the learning objective. Now, what we are going to assess here, practical and communication skills will be assessed in checklist-based assessments. The example I'm telling, the urinary catheterization, as I'm a Shell teacher, I'm taking the example of urinary catheterization. So here the this is a chart you can make to assess our students. Here I made a to check the skills of urinary catheterization. They are divided into two: instrumental method and schematic performance. In instrumentation method, whether student has explained the procedure to the patient previously and take a consent or not, washed his hands with the spirit or not, did he did a donning of the gloves or not, did he requested the assistant when in where required, selected proper instruments or not. These all things will come in the instrumentation method. In schematic performance, here we are going to assess his performance of catheterization, the position of the patient, explain or perform the sterilization of the part, drape the patient with the sterile drapes or not, lubricates the catheter tip and external meatus or not, inserts the catheter into external urethral meatus until urine comes, attaches the saline-filled syringe and inflate the balloon, hangs the collecting bag below the bladder level, secures the catheter or draining tube the patient's thigh, and cover the patient or restores the privacy of the patients and hand washes. So these are the very, very, very important steps which need to be checked in a simulated patient or on a real patient regarding urinary catheterization. For that, you can allocate different marks, and you can check with a checklist saying that ask the student to perform in front of you and give a marks, whether perform, not perform, and what is the total score. And immediately after that, you need to tell that where he did a mistake. Say example, he has not taken consent, or he has not prepared the part, or he has not secured the tube correctly. Then you can cut the marks and you need to tell the students that this step you have made a mistake, so that he will never make such a mistakes, so that he will become a very competent doctor at the end, so that he will achieve all the competencies or certifiable competencies which is required by a teacher. Then comes the fifth method, simulated patients. Obviously, with the name only, you might have understood that. Here, we are taking this instead of patients. If the patients are there, it's well and good. Or else, you can make some patients. Or simulated patients offer a controlled environment for students to interact with real life situations. Structure is an individual is trained to act as a real patient or in order to simulate a set of symptoms and problems. Here we are going to, what are types of assessment we are doing? Communication skills, history taking, clinical skills, application of theoretical aspect in practical scenario. Example, a teacher or a rater. Now, rater or a teacher, here he could be a PG scholar or anybody who is assisting you can be made as a simulated patient. You need to train him saying that he's now I'm taking a patient of wound. So we need to tell what are the complaints of the wound, and he should present this in his own language to the students, and students are asked to interact with a simulated patient. And we are going to assess the different skills like communication skills, history taking, other aspects with this checklist. So here I'm taking example of examination of ulcer. So checklist will be whether he greets the patient or not, whether he takes demographic data completely or not, whether he assesses sleep complaints, associated complaints or not, history of present illness is written completely or not. When it comes to local examination, in inspection position, shape and size of the ulcer, number, floor, age, discharge are noted or not. In palpation, tenderness, temperature, base, depth, bleeding, mobility are assessed or not. Then examination of the nearby lymph nodes, examination of vascular insufficiency, neurological examinations are done or not. So this is a checklist which should be priorly formed, and it should be with a rater or a teacher, and in a simulated environment, the students is asked to interrogate, and you are going to give a marks. And immediately that if any step is missed, then you need to tell them immediately after this examination, so that in his life he will never make the mistake regarding examination of the wound. Now, this is what is required so that to build a competencies in a students. Many times this happens that we do take exam and we leave it. What he has done a mistake and how we have corrected it, that we are not assessing, and that is the importance of these types of assessments. Next comes case writing skills. It is known to everyone. Case-based writing assess the students' ability to construct comprehensive clinical cases. It evaluates the understanding of clinical concepts, communication skills, and their capacity to present a complex medical scenarios. What is structure? Assigning the real patients, or if you don't have any patients, you can go with the simulated patients. So example, you are teaching today with some arterial disorders or disease of the vessels, and if you don't have a patient at the time of assessment, so you can make the use of your PG scholars or some subordinates as a simulated patients, and you can take this type of examinations. So what we are going to assess here, again, we are going to assess communication skills, application of theory into practical, and organization of the clinical concept. So best example for case writing skills are long case and short case. I feel this type of long case and short case should be done in first and second phase of BMS, wherein in early clinical exposure, the students should be able to understand what is the sequence of taking writing the cases. What will be the first? How demographic data should be taken? What is the present illness? How present illness relates with the next the assessment? How this the history will goes and helps for clinical local examination, and how all together helps in investigation and the planning the treatment. So this type of case writing skills could be imbibed or assessed in the first and second degree, first and second phase of BMS students. The seventh one is DOPS. Again, this is a very important tool for assessing. There is direct observation of procedural skills. DOPS assesses the practical skills under supervision. Trained assessor directly observes and evaluates the students' performance, ensuring the competencies in performing practical tasks and procedures. Now, what is the structure? The trainee is assessed during everyday performing procedures on real patients with the DOPS form. So this type of examination, DOPS, could be done on a real-time basis. In the sense, you need to take your trainees or students to the ward, and you can give one case to them, and there you need to assess or already students are doing some say IV cannulation or some dressing or some paracetamol pressure. There directly you can assess this type of tool could be used. So what we are going to assess here, we are going to assess communication skills, professionalism, and procedural skills. Example for DOPS is any surgical procedure or any panchakarma procedure. So in DOPS, there are three categories of forms will be there. There is a form which contains the categories. One is candidate and assessor form, wherein who is the candidate, who is the assessor, that will be taken care. In patient information, all the demographic data of the patients are taken by students or not, that will be assessed. Candidate assessment, this is again very important. Here, candidate assess with some points. The first point will be demonstrate understanding of the indications or relevant anatomy, techniques of the procedure. Second is obtain the consent or not. Demonstrate appropriate preoperative procedures or not. Appropriate analgesia or sedation given or not. Technical ability. Then aesthetic techniques. 6, help whenever there is required. Post-procedural management of the pain plan, communication skills, and professionalism. For this, we are grading below expected level, at expected level, and above expected level. Again, we are going to give marks. A below expected level 1 to 2, expected level 3 to 3, and above expected level can give 4 to 5. And you can assess and you can give how much marks he has done. So whether you can easily assess whether he is competent or not competent. Again, you can tell that what he has done a mistake and what to be improved. Then comes mini CX. The word itself is the mini clinical evaluation exercise. Again, I'll repeat, mini CX is nothing but mini clinical evaluation exercise. Here, it is done in a very stipulated minutes, hardly 10 to 15 minutes are required to assess this tool. Okay, so this tool could be used in OPD basis also. When you have abundant patients with you, and that time the mini clinical examination exercise could be done. So what is mini CX? A 15-minute snapshot of the doctor-patient interaction is assigned to assess clinical skills, attitude, and observations of the students. What is structure? Students is subjected to multiple encounters by different observers with mini-6 form. So you have already mini-6 forms will be there, and within a 50 minutes, how the student interrogates with the patient will be assessed. So what we are going to assess here: history taking, physical examination, professionalism, clinical judgment, organization, oral efficiency, then oral clinical care will be assessed. So this is the rubrics for assessment of mini CX. Here if you see name of the resident or evaluator, OPD setting or IPD setting, whether it is done, then the first criteria is medical interviewing skills, then physical examination skills, humanistic qualities or professionalism, clinical judgment, counseling skills, overall clinical competencies. So here again, you can give Likert scale like unsatisfactory with the marks of 1, 2, 3, satisfactory 4, 5, 6, and superior 7, 8, 9. So according to the performance, you can calculate and give a result to the students. And again, you need to tell where he has done a mistake to overcome in subsequent examinations. The last one is case-based discussion. So case-based discussion is based on the case notes and other relevant written correspondence for a current case in a workplace. In the sense what you are taking the students to the IPD, already there will be end of patients with the cases of field. You will allocate one student, one case. Even you will give the some time for to go through that, and then you assess the skills. And what are the things we'll assess? You'll assess clinical record keeping, clinical assessment, risk assessment and management, assessment and treatment, medical comorbidities, treatment planning, follow-up, professionalism, and clinical reasoning. So here, which case should be given? It will be decided by a teacher or a trainee. Then in-depth discussion regarding the case. Here, a teacher or the assessor can ask anything regarding the already given case, so that he can assess the different thinking capacity or cognitive or affective domains pertaining to that case. Even he can assess reasoning behind what is it, why this is a line of treatment, how it is planned. These all things could be asked, and those things are assessed in case-based discussion. So here the criteria for assessing this type of tool is clinical record keeping, then differential diagnosis and summary list, management plan and investigation treatment follow-up, clinical judgment and clinical reasoning. Again, you need to give below expected level, or above expected level. So again, you need to give marks for that, below expected 1 to 2, at expected 3, or above expected 4 or 5, and they can recheck it. So I'm coming to the end of my presentation. So at the summary, we discussed what is assessment and what is the importance of assessment, what are the types of assessment. In that, I told you many types. Among that, continuous assessment, formative assessment, and summative assessment, which are imbibed in our curriculum. Now, what is continuous assessment? What is the importance of that? What is formative assessment? Why it is carried out? What are tools for that? That also we discussed. And we discussed, we are going to assess. Very, very important thing is that assessment depends upon Miller's pyramid, wherein what is knows how, shows how, and does how. And we expect as a teachers, all our students should be from knows how, they should come, they should become, or they should do does how, they should able to perform, so that they can achieve the maximum competencies in their teaching learning process. So lastly, if you see this picture here, there are a number of animals are there, and assessor is asking to climb the tree. It is very difficult. It is obviously it's very difficult for these animals. See, the animals are even fish, cat, some dog, something are there. Here only the bird and the monkey can climb. So what I mean to say is, as per the so all students can't be assessed with a single method of assessment tool, or this could be addressed in another way or taken in another way. That is, all different types of tools are required to assess different skills of assessment, or to assess the cognitive domain, you need to use different tools. To assess affective or psychomotor domain, you need to use different tools. So only you can assess all the students. Why? Because some students may be good in cognitive domain, some may be very good in affective domain, and some could be in very good in psychomotor domain. So everyone, you can't generalize a single question for a single tool for each and every students. With this, I'll stop. Thank you. Thank you, Ananda.
Thank you so much, sir. Now panel is open for question and answer. If anyone want to raise any query, you may raise your hands. And Dr. Amrita, you can unmute yourself. Dr. Amrita.
Yes, sir. Am I audible, sir?
Yes, ma'am, you are.
So I had one query that what exactly is the difference between OSCE, OSCE and DOPS? Because when I try to understand this, I always feel that we are trying to observe the procedures only. So what exactly is the fine differentiation between these three procedures?
Hello,
And
madam. Hello, madam.
hello, sir, am I
Madam.
audible?
Yes, yes, madam. This question will be opt if you ask this at the end of my second presenter or next session. But let me tell you, one question was there, like apart from OSCE, what is the DOPS? Direct observation skills means here, madam, many times when you ask the student on table, or in the sense in the IPDs, if students are making some, say, dressing, or they are doing some minor surgical procedure or something, there only you are going to judge their performance on a real-time basis. It is not that something you are taking as an exam. If they are doing in a ward and you are assessing that skill, then that could be called as, that type of assessment is called as DOPS.
Thank you, sir. Next query, Dr. Tejaswita. You can unmute yourself and raise.
Hello, good afternoon, sir.
Yes, ma'am, you are audible.
Yeah. Pradeep, sir, can you hear me?
You may raise your query, ma'am.
Hello. Okay, ma'am. Okay, sir, my question is, if, for example, we are doing an assessment, periodic assessment, like case-based discussion. So, sir has shown a checklist for that, where we can give gradings for the students. My question is, how can we put it in the marks format? How has sir done that? Like out of 15 marks, how can we combine that?
Madam, it is very simple. See, madam, as you know that all PAs are 15 marks, right? So as per your
Yes.
criteria, you need to divide already you have made a criteria. Say you made history taking as a 1 marks, clinical examination 3 marks. Like that you can divide, or each step could be divided to give some marks, and it should not exceed more than 15 marks. So which are very important, you can give more priority to that,
Okay.
give more marks that, and you can assess it. It's very simple.
Okay, sir. Okay. Thank you.
Thank you.
Thank you so much, ma'am. RS. You may raise your query.
रेस्पेक्टेड सर, मेरी एक प्रॉब्लम आती है इसमें, मतलब असेसमेंट करने में हमें फेस करनी पड़ती है कि हमारी क्लास में जैसे 75 स्टूडेंट हैं, और पर स्टूडेंट को अगर हम कोई एक प्रॉब्लम दे रहे हैं, फिर उसको हम जज कर रहे हैं और उसके बाद उन्हें बता भी रहे हैं कि ये गलतियां आपने की हैं, तो हमें तो 1 घंटे का टाइम मिलता है पीए एग्जाम में, तो कैसे हम 75 स्टूडेंट्स को हम एक के बाद एक वो कर पाएंगे, असेस कर पाएंगे?
Madam, very nice question. Very good question. Now, obviously, this happens to each and every teacher. You need to do something called, what we practice at our institute is, say today assessment exams are there. Now I divide my students, 25 students of Tantra, or different, you say, subjects. You need to divide, say you have 100 students divided by 6. So the group will become smaller. And in 1 hour, I can assess for only stipulated students. That could be possible.
सर बट इस केस में हमें 3 या 4 दिन वो पीए एग्जाम लेना पड़ेगा क्योंकि हमें 1 आवर अपनी क्लास का ही मिलता है
हाँ मैडम,
एग्जाम
you
लेने
can plan.
के
Say today 15 patients. Next day when you have your other class, your own class, Shailatandra class or whatever your subject, that time you can plan. Or meanwhile you can adjust such a way that different subjects are there. So you can select today we're going to discuss. We'll take exam on DOPS or something. Example I'm telling you. So KC shall have different subjects. They will divide the students, and all the students will get divided in a small group. They'll go to their respective teachers and they'll get examined, and then after that they'll come to you. And that could be possible in a day, or it could be planned in a different periods.
थैंक यू सर थैंक यू सो मच
Thank you. Thank you.
Thank you so much, ma'am. Shashikala, Dr. Shashikala.
Hello, sir.
Hello, madam.
Sir, namaste.
Namaste, madam.
Sir, my doubt is for each syllabus point, they have given an assessment method, sir.
Yes, madam.
Especially related to practical, whether we need to conduct those assessments for every practical or not, sir.
Madam, in syllabus there are different methods are given, but
Sir.
it won't mean that only those the tools should be used. No, it depends upon the topic. Say you are a teacher of Shailatandra. As I'm teacher, I'm telling you. Say today you taught regarding some procedure. Now you feel that it need to be assessed with DOPS. You need to utilize that tool. So
No, sir.
we decided by teacher.
Sir, my doubt is whether it is compulsory to do the assessment for that practical, or whether we can use that assessment method if you want to conduct the assessment for specific practical during summative or formative assessment.
हाँ madam. So you can please try to remember that the periodic assessment should be taken for 15 marks. Here, these tools, whatever I explained, that could be utilized for conducting the formative assessments.
Okay, sir.
Not
Like,
as a
it
not as a
means there is
summative.
no need to conduct assessment for, during every practical.
Madam, if you ask me as a teacher, let me tell you, if you do at the end of each practical, it is more very good. You are one of the best teacher, but many times this we won't get. But let me tell you, QCA people do ask this. Now, either you have taken a class on some procedural skills, and whether after class did you examine, did you assess them? They'll ask. If you have any such a what document, you will get a good marks.
But time it will be difficult, no, sir?
Difficult. That you need to plan, madam. Say usually our practicals are for 2 hours, so you can plan for 1 hour for 45 minutes. Your practical 15 minutes for assessment. Assessment like that you can plan and you can execute.
Okay, sir. Okay. Thank you, sir.
Thank you.
Thank you so much, ma'am. Any other query? Dr. Tripti, are you there?
Yes, yes.
Shall we move to next?
Yeah.
Thank
So
you.
before moving to the second session, my heartfelt thanks to Dr. Pradeep Shinde sir for enlightening us with their assessment methods in ASUS education. It was a part 1. Okay. So next we will move on to session 6. That's the last session for faculty development program. Assessment methods in ASUS education part 2 by Dr. Naveen V. Sir, Associate Professor, Department of Dravya Guna, Sri Sri College of Ayurvedic Science and Research, Bangalore. Here is a small intro about Dr. Naveen V. Sir. Now, Dr. Naveen V. Sir is a holder of PhD with more than 15 years of academic experience. He's a master trainer for educational methodology and theory-based assessment in RGHS, life skill trainer in NIMHANS, published researcher and academic reviewer, organizer of national academic and youth development programs. He has many certificates of courses like educational leadership and soft skills development by IIT Kharagpur, essential communication strategies for leaders by IIM Bangalore, etc. So let us now listen to Dr. Naveen V. Sir on assessment methods in ASUS Education Part 2. Over to you, sir.
Thank you, Dr. Trupti, for the introduction. I'll just share my slide. Please let me know it is visible. I hope it is visible.
It's visible, sir.
A very good afternoon to all the faculty members who are attending this Yukti program, the 3-day faculty development program on education methodology. At the outset, I would like to extend my gratitude to office bearers, all the office bearers of NCISM, especially Dr. Manisha Upendra ma'am, Chairperson NCISM, Dr. Alama Prabhu sir, President BOA, and Dr. Anand Katti sir for giving me this opportunity to put forward my views with respect to education methodology. This is one fun illustration that normally we come across. The main problem with assessment starts with this. So there are two perspectives to this illustration. One is from the student perspective and another one is the faculty perspective. You might have heard that students coming to you people and telling that the questions were too lengthy. I was not able to finish the answers on time and I didn't understand what to write and what not to write for the particular question. So this is one perspective from the student perspective. I hope everyone would have come across this. I also request Shubham to keep the chat box open so that I'll try to make it a little bit of interactive as such. So this is one perspective. The other perspective is with the evaluator perspective. The same questions and the evaluator depends upon the evaluator how much marks is going to give to the students. Say for example, if they ask something question about a drug called Guduchi. Okay, as one evaluator might be expecting a botanical name out of it, whereas another evaluator might be expecting a rasapanchaka of the drug, or another evaluator might be expecting the activities of the drug. So what has happened here? This has become more and more subjective in nature with respect to the assessment as such. To remove this subjectivity in assessment, so it is always important and integral part is that it has to be made more objective in the assessment methods. So in this particular session, we'll be looking at assessment methods in Ayurveda education, second session, which specifically will be dealing with learning objectives to discuss blueprint of student assessment, illustrate the structure of multiple choice questions, list the do's and don'ts of preparing MCQs, and illustrate structure and importance of a typical long answer question, modified essay question, and short answer question. Explain the process of conducting OSCE or OSPE in Ayurveda or any other Siddha and Unani system also. Discuss the role of viva voce in health professional assessment and compare traditional viva with objective structured viva. These will be the specific learning objectives of this particular session. So let us recall few things before entering into the assessment methods. So specifically, we all know that a curriculum is based on three important components, any curriculum for that matter. So it is basically framed based on the primarily on the educational objectives that have to be fulfilled. And once that objectives are framed, then it is very much essential to look for the teaching learning methods and medias that we can use for fulfilling that respective objectives. So once we use this particular teaching and learning methods and media, so it is also very important to know what is the outcome of that particular objective as well as the teaching learning methods that have been used. For that purpose, we use something called as evaluation or assessment. So once the assessment is done, we'll come to know what is the status of the student. And if they find that if the students require us to improve them himself, then if you find that these all three are not aligning with each other. So if educational objectives and teaching learning methods and assessment are not aligning with each other, then again we might have to reframe the educational objectives and again adopt educational methods and again try to assess. So any curriculum, this is called as a curriculum spiral. So it will be a cycle as such, which is a very integral part of any education system as such. So we all, the previous speakers have already spoken from the past 2 days about the different aspects related to education methodology. The most important thing is the Miller's pyramid among that. So as we all know that it consists of 4 levels: know, know-how, show, and does. So know and know-how, it's basically comes under the domain of cognition domain, whereas shows, how, and does comes under the behavior as well as the skills domain. So if you look at different types of assessment methods that we can adopt at different levels, see, at no level, it is only we should concentrate only on gathering the facts which have already been stated in the text or in the books. So therefore, we can adopt something like MCQs, essay, viva, or quiz. They are the type of assessment methods that we can adopt. When it comes to know-how, it is basically related to the next level, that is called as interpretation and application of the matter that you have studied. So in this, you can use case studies, simulations, essay, and MCQs. And next comes shows, how, and does is specifically related to the psychomotor as well as the affective domains. When we talk about this, the most important educational methods or the tools that we use are OSPE, OSCE, DOPS. So these are specifically related to demonstration of learning, which is related to psychomotor. At the same time, it is related to how they are doing it, that is related to the affective domain. So this is the another pictorial representation how it can be understood with the respect to Miller's pyramid, Bloom's taxonomy, and Gilbert's hierarchy. So knows how, as per the Gilbert's hierarchy, it comes under the context called as recall and understand, whereas knows how come under the understand, interpret, and decide. And whereas the other higher levels will understand, interpret, decide, and demonstrate. And after demonstrating, does is what is, it will become a master in that. So it is automatism comes into purview when you're talking at the level of does. So it is our duty to see that the student moves from know level to does level. So this is the purpose of any education system as such. And coming to the with respect to the content prioritization, so NCSM has already given us the content should be given important to what content important should be given. So I'll just quote one example here. We used to get a question about Bhav Prakasha Nigantu. So many of us used to write Bhav Prakasha Nigantu, his father's name is Latakana Mishra, all those things. See, knowing about Latakana Mishra, it is nice to know, but it is not very much essential to fulfill our objectives. At the same time, if you want to know the timeline of Bhava Prakasha Nigantu, so that is desirable to know. Why? Because you'll come to know who are the authors who are above him and who are the authors below him who have contributed to the our Nigantu as such. So, however, now must know is that Gunakarma of Haritaki is an example, wherein it is very much essential for a student to understand Gunakarma or the activity of Haritaki. So content prioritization is very much important whenever we are conducting or doing any assessment as such. So for this purpose, there are different levels of cognition. So this is again at every level, at cognitive level, psychomotor level, and at affective level. There are different levels you can adopt depending upon the requirement. You can adopt at the different levels as such. You can assess the students at different levels. So this has already been mentioned by the previous speaker, Deshpande sir. So in this particular session, I'll be concentrating only on the summative assessments, something like long answer questions, short answer questions, modified short answer questions. All these things will come under constructed open questions. Long answer, short answer, and modified will come under constructed open question, whereas selected response questions, all your MCQs will come under the purview of selected response questions. So this is how we can classify them in the classification of different assessment items. Okay, so you can clearly see that multiple choice, matching, true or false come under selected. Performance tasks that specifically related to the practicals. So we'll call, it will come under OSPE, OSCE, all practicals will come under the performance task. So for any assessment to be made, it is essential or critical to prepare a blueprint. We all know that whenever we construct any house or a college, we give importance to different parts of the building, right? We can't give the big space for a kitchen and a small space for a hall. So similarly, you have to design a blueprint for assessing theory-based assessment as such. So how it has to be done, I'll just run through certain methods, and I'll just show with an illustration with our NCISM blueprint. So it will be easier for everyone to understand it. So this is the method that we have to always follow whenever we are framing a blueprint for assessment. The first and initial stage is that you have to tabulate the curriculum content. We know the course outcome, what we have to do. We know the program outcome, course outcome. Then we have to prepare a curriculum. When we prepare a curriculum, we have to tabulate this curriculum into different parts or different contents. Once you tabulate that curriculum content, then you have to give the priority to those contents, whether that particular content or the objective, whether it is a must to know, whether it is desirable to know, or whether it is nice to know. So once you prioritize, then you should also try to calculate the weight of each topic or unit in the course. So how to calculate the weight, I'll show in the coming slides. And then we have to decide based on the weight and impact of that particular topic, we have to define the number of items or questions for each topic or unit. Once you do that, then you have to determine the cognitive level of each content. Why I'm talking about cognitive level here? Because since it is a theory based assessment, it is always we have to assess the cognitive levels, different levels of cognitive domain rather than psychomotor or affective domain. So you have to determine which cognitive level the questions has to be put. Then you have to select the appropriate assessment tool for assessing that particular question. So whenever we are designing a question paper, we have to keep this in mind. So whenever writing specifically for a theory-based question paper, you should always give 80% of the questions should be from the cognitive level of knowledge and understanding. That is the basic two levels of cognitive domain. So remaining 20%, try to put under the application and problem solving domain of the cognitive domain. So this has to be kept in mind. At the same time, we have to see the weightage of the content for each topic. So must know should always be given 90%, desirable to know 8%, and nice to know 2%. It is always recommended not to give any questions from nice to know topics. Okay, because it is only 2%, it is a very negligible percentage. So it is always recommended not to give any questions from nice to know topics. At the same time, the common method which have been followed by many of the universities are 40% should be from long answers, 40% should be for short answers, and objective type should be 20%. So it can be clearly into 40, 40 and 20 for 100 marks, it can be clearly done. So these are some of the steps which are done while preparing any blueprint. So here I just want you to people to just remember for this session, remember about these two important points that is called as impact or importance and frequency or clinical importance. So any topic that you take, you should see what is the importance of that topic and how frequently and how important clinically that topic is. So based on that, you have to calculate the questions. So based on the weightage and multiplying by impact and frequency, then we are going to prepare the questionnaires. So here I just given an example. See, non-urgent little is first impact. That is weight is very less. Okay. So example is common cold. So impact is tuberculosis. It is serious but not life-threatening. So weight of that particular topic is 2. Life-threatening and emergency myocardial infarction. So here the weightage of this particular topic might be 3. So it carries more weight. Similarly, based on the frequency or occurrence, you need not ask the questions which are rarely seen. Okay, rarely seen type of topics you can avoid because weightage will be less. Very common topics you should ask more, and relatively common you should give weight. So by calculating such weight, you can decide which topic deserves how much marks for assessment. And based for non-clinical subjects, that is for the clinical subjects, whereas with perspective to non-clinical subjects, so weightage should more weightage should be given to the topics which have high clinical application. So that has to be kept in mind while preparing the question paper. So this is how we can frame like topic 1, topic 2, topic 3, topic 4 based on the impact and frequency we have calculated. So here at the last column, you can see that topic 1 deserves to get about 8 marks. Topic 2 might get 16 marks. Topic 3 might get 37.5 marks. So like this, if we calculate, we should get 100 marks. So this should be the weightage given to the topic. So similarly, when we talk about the three types of questions that has to be prepared for the questions, so we should always keep in mind that MCQs should be asked at two levels: to assess their recall assessment, and also to assess their reasoning. Both should be given equal importance, which I'll be telling in the coming slides when I deal about MCQs, and at the same time SEQ and LAQ. So like this, if you divide, we can easily come to know how many questions has to be asked. To make this very simple for us, NCSM has already given us a wonderful blueprint so that it becomes easier for us to prepare any question paper. So here you can see that we were discussing about that flow chart in the previous slides. So the first was the tabulate the curricular content. So you can see that the learning objectives are the curriculum content here. So you can see that the define Dravya Guna Vijnana, explain the role of Dravya Guna Vijnana. So these are the objectives. So these objectives become the content. So then after doing this, you have to see priority index for each topic. So you can see that our NCSM has given knowing the definition of Dravya Guna Vijnana is a must know topic. So MK. Okay, so here priority index has to be given. Similarly, you might come across something called as DK and NK. So wherever NK is there, try not to ask any questions from that particular topic or from particular objective. Once you become aware of this, then calculate the weight of each topic or unit in the course. So here you can easily see that Dravya Guna Vijnana, under that first only 1 mark. So it clearly indicates that, so you can ask only about 1 mark question or MCQ question from here, because you can't ask SAQ or LAQ. So in Dravya, you can assign 6 marks. So 6 marks, how you can do? Either you can give 1 5 marks question and 1 MCQ question. So it will fulfill 6 marks. So similarly in the concept of Guna, you can either do 1 10 mark question and 1 MCQ, or 2 5 marks question and 1 MCQ. Like that it can be divided, but at the same time you should keep in mind that, so if you are taking one LAQ from one topic, you are not supposed to take the LAQ from the other topic, because you have got only 4 LAQ questions which can be made in the question paper. So that we should keep in mind whenever we are framing the question paper. So next we have to define the number of items for each topic. So here it is clearly mentioned, must know, you should have 7 SAQ, desirable to know only 1 SAQ. So no questions on nice to know. So the clear instruction has already been given by NCSM. You can easily follow based on these instructions. So on the left corner, you can also see that MCQ, Dravya Guna Vijnana, you can ask only MCQ. In Dravya, you can ask 1 MCQ and 1 SAQ, you can't ask LAQ. So there is clear instruction. So there should not be any problem for any of the faculty while framing the question paper. So next you have to determine the cognitive level for each content area. So again, cognitive level domains in, again, cognitive will know that cognition, knowing, cognition, different levels of cognition are there. So that has to be looked into. And also the Miller's pyramid, show, know how. So it is always see that, you can always see that in the question paper, you can see wherever theoretical aspect are there, it is related to know and know how, because it is related to the cognition. Okay, so that you can look into it, and then select the appropriate assessment tool. So the one question was asked by one of the in the previous session, whether we have to do all these things. So it depends upon the faculty, and they should decide whichever is feasible and whichever can be adopted, which can fulfill the objective of that particular objective, that can be used for your assessment method. It is not necessary that we have to do everything also. So this is about the blueprint aspect. So once we have the blueprint, then framing of question paper and framing of the assessment tools will become very easier. So, and this is the next topic that I'll be dealing with you. This you might have come across, many of us also might have come across this method we use while answering MCQs. And you can see the other picture where it appears to be very similar. And this creates a confusion in the students to which answer we have to give. So to understand this MCQs, it is very much essential to understand how MCQs have to be framed. What are the guidelines we have to adopt while framing the MCQs. So whenever I talk of MCQs, again, this also, since it comes under the theory-based assessment, so it should fulfill only the two levels of domains, that is two levels of Miller's pyramid, that is know and know how. Because you can't see any what you call as skills you cannot appreciate here. So properties of MCQs, we should always see that the MCQs are objective in nature. So that means, see, these three words that are present here, objectivity, validity, and reliability, they're almost interrelated to each other. So the question should always be objective in nature. That means it should give similar type of answers, and it should be validity. So when you write a question, so it should fulfill only the cognitive domain. It should not try to assess the psychomotor or affective domain. So that important we have to keep. So that shows that it gives you the same. If you adopt this instrument, it should give you the same answer. So that is validity. So when it comes to reliability, it should be design dependent. So even if you do it multiple times, if you give the same type of question, you should get similar type of responses. So that is what I call as reliability. And at the same time, it should be feasible. It should be easy to answer, and it should be easy to frame the questionnaire also. It should be easier. So we should keep these things in mind while framing the MCQs. We come across different types of MCQs while framing the MCQs. However, in normally we try to adopt only the first type that I mentioned here, that is called as A type or single best response MCQs. However, we have got equal chance to adopt other types of MCQs also called as matching type, X type, multiple completion type, relationship analysis type, and R type extended matching type. These are also other methods. I'll just quote with few examples so it will become easier for you to understand. So any MCQ should have three components in nature. While framing any MCQ, you see that these three components are there. Then only it will fulfill the MCQ. The first one is the direction. So direction is nothing but what you want to ask. The second one is that premises, in which context you want to ask that question. And the third one, what are the four responses that you are going to give? Among that, which is the best response the student has to answer. So these three components are essential while framing any MCQs as such. So I'm giving just an example with matching type. So it has got three components: direction, premises, and response. The direction is match the following karmas and their agriya dravyas. Okay, so here you can see that the premises is that direction is karma and agriya dravyas. So what is the premises? Here Vatahara, Vamana, Virechana, and Vishyavatara. And I have also given responses here. So the students have to select the correct response from this particular answers. So this will become a matching type. This type of type can be adopted in your formative assessment type methods rather than in summative assessment like final year question paper. This can be adopted in such places for while you're conducting formative assessment or periodic assessment. So it will give you similar answers from all the responses. So it will become easy for the teacher to give correct marks. So next is X type or multiple true or false. Here also for each alternative in the item below, you have to respond just true or false. So I have given the premise, the direction is the properties of Guduchi is the direction. Premises is that it has got Tiktarasa, Shitavirya, Katuvipaka, Tridoshara. So a response true or false. You should answer only in whether it is true or false. Only two responses you have to give. So by this also you can easily get the similar type of responses, whether it is true or false. Giving marks would be more objective in nature. So this is multiple completion type. So this type of questions are basically asked in assessing the aptitude as such. So this can be also adopted. I'll not go detail into this as such. And relationship and analysis type. This is also another type wherein we have to give the assertion and reason. So this also is specifically, we can adopt such type of questions for checking the aptitude. That is the second level, that is reasoning and interpretation level. If you want to assess about the student, then you can give such type of MCQs as such. So R type. So here extended matching type. Here you are giving theme is indication of dravyas. I have given the options like Nirgundi, Gokshura, Bala, Shunti, Kadira, Lajjalu. I'm giving them a lead. For each of the following scenarios, select the most likely drug of choice. So from this items I have given, a 23-year-old suffering from bleeding piles. Among the above 6 drugs, a student should select a correct drug of choice for that. So this also will become more and more objective in nature because you already given the list. So he has to select it from that particular list only. So this type of MCQs can also be prepared. So they are most commonly used A-type MCQ that we put in your question papers, our question papers. So here it is select the single best response. So here it contains again 3 items. One is called as a stem, direction, stem, and key. Okay, so direction is that you have to tell the what answer should be given, and stem is that what is the question is all about and what are the answers. And in that answers, which is the correct answer? Correct answer is the key answer. So when you are preparing a questionnaire, it will have these many components. So I just quoted an example. Malleus is the bone situated in. So it is a recall component at very basic level of question that I am asking here. So here I am asking ear, palm, hip, and jaw. So hip, palm, and jaw are nothing but the distractors. So whenever you are giving an MCQ, you should put proper distractor. There are rules for giving the distractors that we will discuss in the coming slides. So what are the most common pathologies that we come across in MCQs while preparing MCQs is that content under representation, that is undersampling. So because we'll ask questions from the same topic, 5 questions, another topic will not ask any questions. So that is called as undersampling. That shouldn't happen. If you want to avoid that, follow blueprint and accordingly you can ask the MCQ question. The second pathologies or issues that we come across is the construct irrelevance variance. While constructing the items, your irrelevant options or irrelevant type of options will be given, which will create a confusion in the student's mind, which will cause problem. For that, the best solution is that it's always better to keep on training yourself. After preparing the MCQ, review it and validate it, and then you can give it to the students. So this is the impact. So if normally 60 to 75% of MCQs are flawed, due to which many of the students might fail also. So it becomes very essential for us teachers while framing an MCQ. We should see that we should take very much care while framing the MCQs. Can anyone find the problem in this question? I request if chat box is open, if you can type your the issue here. If chat box, I request Shubham to open the chat box so they can type here.
Chat box is open.
Yeah. Yes. See, I can see many people are giving very correct answer. That is the error spelling. Obviously, the spelling error is the wrong here. So such type of issues will happen while framing the MCQs also. So these are the certain things that you should always follow while framing the MCQs. Sorry. So you should be grammatically correct. You should be clear and precise language. All alternatives should be of similar length and complexity. And you should avoid synonyms wherever possible. Our use mutually exclusive or plausible alternatives. Cautious use of none of the above and all of. Normally we do this. None of the above, all of the, every time we keep giving. That should be avoided as far as possible. But even if you are using, how it has to be used, I'll tell you. Avoid negatives like not and except as far as possible. It should pass the and cover test. Avoid abbreviations when you are in giving the responses. Avoid providing hints or clues in the stem. Avoid irrelevant information. You should vary your key positions and all try to focus on high order thinking skills. I'll give you the example. I will show you. It will be easier for you to understand. So this is one of the, you can here also you can spot the error. So here a medical professional who specializes in the treatment of eye disease is known as surgeon, ophthalmologist, gynecologist, radiologist. So basic issue with this question is that it is grammatical inconsistency. See what is happening here. All these are ending with logist, but this person is ending with surgeon. So that there is an inconsistency in the grammar. So such type of things you should try to avoid. Similarly, here, Raju is 4-year child who's facing difficulty in concentrating in the class. Which psychological disease he might have? I have given certain options here. What is the problem with here? Here the answer length. By the time, see, autism spectrum disorder, psychosis is one word. Autism spectrum disorder is 3 words. Okay, so here the answer lengths are varying. So that answer length should be same. So weight gain is seen in which of the following conditions? Hyperthyroidism, hypothyroidism. Can anyone tell what is the issue here? So in all probability, out of these 4 options, these 2 options, among these 2, one might be correct. Okay, so here when 2 alternatives are opposite, one of them is usually correct. Okay, so such type of things also you should try to avoid. Similarly, which age group are called as youth? See, you can see that there is a, when you're framing a 15 years, 15 to 20, 16 to 24, there is no clarity in the answers that has been given here. So that you should avoid. Should always be mutually plausible and exclusive. So it should be something like a continuity, or it should be exclusive. You can't give a 15 to 20 years. Okay, so like that you should avoid. So which of the following is a type of research? Here all of the above we have put. When we see this, will definitely the student will answer as all of the above. Okay, so here what you can use, you should be caution while using all of the above. You should always use all of the above and none of the above as a distractor, not as a answer. So here you can see that which of the following is measures of central tendency. Range, mean, standard deviation, all of the above. Many times student will put all the above, but we have to see only that it is the mean that is the answer. So this should be used as a distractor while framing the MCQ. So similarly, which of the following is not an example of mineral drug? People can easily identify, but when mentioning this word as not, so it is always better, it should be meant in capitals and it has to be in bold. So many a time students will make a mistake. They will try not to see the word not and they will write the other answer. So you might fail in the exam. So we should keep this in mind. And always, which of the following is true about asthma? Here you can see that if you look at all the answers, it appears to be all the answers are correct. Student will be in a confusion. So here it is failing the hand cover test. It is ambiguous options are given. Yeah, see, if you write salbutam also, you should give mark. If you use of masking advisable, yes, it is advisable, you have to give marks. So therefore, such ambiguous options should not be given. So here in this question, it is basically, I think you should be knowing by this time what is the issue here. It is basically the abbreviations. Okay, PPE means it might be PPE kits also. We don't know, right? So it's always better avoid abbreviations. As per Shushruta, number of doshas are here. The main thing is that whenever you're giving certain numbers, try to arrange the numbers in order rather than giving in different orders. These are some of the rules which are followed while framing the MCQs. So here the MCQ should be based on these 3 components: recall, interpretation, and problem solving. Okay, so therefore the question should be based on recall, interpretation, and problem solving. Any questions which come under the purview of interpretation and problem solving are called as higher order thinking skill or odds. So here this is an example for recall. As per Shushruta, number of doshas. It is just recall they studied in textbook, they recall and they will answer here. So the same sample for example for interpretation. So you can give certain case scenario for to interpret which group of allopathy drugs are primarily used. Here you can see that there is a scenario called as emergency and clinic visiting at a acute attack of asthma. So among this, because here acute attack is there, and which these are all the drugs which are given for asthma. But in this, which is given for acute attack, so that has to be given by the student. So say example for problem solving. So you can frame these examples like among Vajikarana karma, which can be employed as an option for suffering from retrograde ejaculation. So here there are, see, you can see all are Shukra, Shukra, Shukra is common, but only the other option, Shoshaka, Rechaka, Stambhaka, Shodhaka are different. Okay, so here the student, he has to remember and he has to interpret and he has to decide which is the correct answer among all the for the question. So this is again the summary of MCQs that has to be done. So this can be followed for while framing the MCQs as such. And this is another thing that we all might have come across while setting the question papers and also while assessing the question papers. Students will find this very difficult. This is where students will come to us stating that, sir, they asked exam for Paradi Gunas. What should write for 10 marks? What I should write and what I should not write. So it is taking more time for me. I was not able to complete the other questions. So when the questions are framed like this, it becomes very difficult. And also for the evaluator, it becomes difficult to bifurcate the marks to which component I should give how much marks. So that becomes a issue with many of the assessment. Then assessment will become more and more subjective and some people might pass, some people might fail. So it becomes an issue. So it is therefore always we have to go for something called as constructed response items. We should always keep in mind that it should produce a or construct the answer. Student should construct the answer, and it should always assess the Gilbert's intermediate or high level of cognitive domains as to be addressed in while framing this CRQs. So these are the examples of CRQs: long answer, SAQ, and modified short open and modified essay questions. Short open questions we don't have as per the NCSM norms. We can adopt these three. And this LAQs should always assess factual knowledge. So always when you're making an LAQ, try to adopt which related to the recall, that it should be give the knowledge about fact. It should always try to assess the thinking, organizing, and reasoning ability of the student. And it should also assess the expression and language, because since it is an essay question, language and expression is also important. So, and it should also assess higher order or critical thinking skills. This has to be kept in mind. So this is what a format of constructed response. It can be adopted in these three levels: either recall and remember type of questions, understand or interpret type of questions, or problem solving or decision making. Problem solving decisions, we are like making prediction, explanations, like that. So when you are using this, framing this questionnaire, this active verbs, use of proper active verbs is very much critical. Then only you can tell which objective you want to fulfill. So here active verbs are important. So these are some of the examples. If you want to just have recall, list mention are some of the examples. Yeah, if you want to go for understand and comprehension type of questions, describe, interpret, discuss. In the application type or problem solving, plan something for a disease, something like that. I'll just quote with examples. So these are the guidelines that you should follow. So see that students are required to answer the same question. Clearly define the task or structure of long essay question. Avoid using questions for content that can be better assessed with other assessment tools. Say, for example, don't ask questions which can be assessed, which can be easily assessed through psychomotor skills. So psychomotor skill questions you should not ask here. You should clearly define the intended learning outcome. Use clear directive words or verbs. Set relatively large number of short answer questions and specify relative point value based on your blueprint. So the same questions that I put it on the previous slides. So you see whether we can see that whether it can be framed in a different way. So here define guna and discuss the clinical applications of guna. Here the student should answer only, they should define guna, and he should only discuss clinical applications of paradigmas. So it becomes little more specific, even if not completely specific in nature. It will become little more specific compared to paradigunas. Explain in detail about paradigunas. So similarly, saptadhatus. You can ask list saptadhatus, mention their respective upadhatus, and discuss the karmas of saptadhatus. Like this, you can frame different active verbs and you can frame, so that what will happen, you can decide how much marks should be given. So for listing saptadhatus, you can give 2 marks, mention the respective upadhatus 2 marks, and discuss the karma of saptadhatus 6 marks. So totally it might come down to 10 marks. So like that you can adopt. So similarly, you can give like this: discuss the drug Gugulu, and that what is expected from the student, only the botanical name, gross morphology, types, and rasapanchaka. So again, scoring the marks would be easier for you. So like this, it can be adopted. See, intestinal obstruction given for 10 marks. What to be done, what to be written, right? So therefore, instead of that, if you put it in the different way, like mention the etiological factors, signs and symptoms, and line of treatment. This is what which is clearly mentioned. You should only list, you should only mention, you should only propose the line of treatment. So like this you can do. Similarly, modified essay questions, you can modify the same questions by giving certain scenarios, like the clinical scenarios you give, and based on that, you can ask different questions. You can further divide it. So watery stools associated with loss of appetite, pain, abdomen since 2 days. So list the causative factors, that means etiological factors or nidana, which are studied in textbook. Analyze the types of karmas which can be adopted. It might be grahi and stambhana, and how grahi and stambhana will can be given here. List the 4 drugs. Give the examples of grahi and stambhana drugs, and plan a diet for the above condition. So it becomes easier for the student to answer specifically, and even for the evaluator also to give the specific marks for the student. So short open questions we don't have basically. I'll just skip the slides. So the next one is your practicals. This also you might have seen. I would like to ask the faculty members, when you are doing your PG and UG, you might have know the people whose name starts with A and the people whose name starts with Y. So you can see that the person who starts with A will be having about 30 minutes and practicals and viva, but whereas the other person you might be having 5 or 10 minutes. So again, it is becoming subjective depending upon the examiner also, and the mood of the examiner and the time of the examiner. So therefore, it is very important to see that practicals are also subjective in nature. So to understand this, what are the things that we have to assess in practicals or clinical skill assessment? Please keep in mind that we should always assess only higher order skills in practicals. Don't assess recall skills, because recall skills have already been assessed in your theory-based assessment. So here try to assess higher order skills, and it should evaluate affective domain. Very important, even though it is practicals, because we are dealing with clinical departments and ours is a biomedical science. So affective domain is an important domain that has to be assessed in practicals. And we should always try to assess how the student is able to bridge the gap between knowledge and practice. And we should also see that it should enhance the validity of assessment, and it should promote the authentic learning. Students should be in a position to do that. So that has to be done. And while assessing this, we should also see that wherever possible, it should give you immediate feedback. You should give the immediate feedback to the student, and also it should be a feedback to you also to see whether the assessment method or tool that you have adopted is a correct tool or not. So that has to be looked into. And it should ensure that the student is able to fulfill that competency which has been given in our curriculum. So OSCE is the most commonly and most nowadays it has been very relevant and prevalent in clinical courses as such, biomedical courses. So here predetermined decisions are made, and then competency based on the competencies and checklists are made, and then you are going to conduct the OSCE. I'll just show you how it is done. So you are always, these are the checklists that you should keep in mind. Okay. So the practical OSCE should be objective in nature. You should always have a pre-agreed checklist. You should always be observable. Individual competency should be observable. So there should be negative course scoring in case of major omissions. Clinical competencies should be broken into specific skills, and testing should be uniform. It should be same for all the students. It should not vary. It should assess your skill, knowledge, and attitude and communication domains. So these are some of the things that has to be assessed: history taking, clinical examination, identification of problem, communication skills, outlining management, interpretation of data. So when you do this OSCE, so these are the methods that you have to follow. Prepare an agreed checklist, and then design about 15 to 20 stations. Set a time for each station. There should be a set time. And then the student will move in rotation basis. At the end of buzzer, the student will go to the next station, and station should be made into two stations, that is called as procedure station and response station. So in procedure stations, you have to make the student to do the procedure, and in the next station, you should make the student to respond to that particular procedure. So the station might be flexible, depends upon the facility, staff, space. You might not get patients, you might put a dummy people in your stations, you can put it that. And scoring has to be done. Whenever you are doing scoring for procedure, always maintain a checklist, and for responses, written marking should be given. So this is how it can be done. First station is a response station. Second station is a procedure station. Third station is again a response station. So like this, alternate stations can be made depending upon your utility or depending upon your assessment methods. So here I just given an example. Perform auscultation of chest on the patient or dummy. So this is a performance that has to be done. Next one is the response station. Here is interpreting the findings in the given X-ray film. So it is a response station. Next one is conducting a peak flowmetry test on the patient. It is again a performance. Next, list exogenous causes of bronchial asthma. It is again a response. So like that, you are going to give. Prescribe ideal drug, demonstrate procedure for nebulization. Like this, you can prepare different types of stations and you can assess the student. So this is the checklist that you can prepare. So you can see that for performance, position of the examinee, whether he's standing on the right side or the left side of the patient, that has to be marked. Ask the chief complaints of the patient. First, he has to ask the chief complaints. Then he should take a consent from the patient before doing any auscultation. Then he should explain the procedure, what he will be doing, whether it is done or not, whether he is using stethoscope or whether he is using any other tool for assessment, that has to be done. And then we have to assess the performance and whether he has thanked the patient or not. If you observe here, asking the chief complaint, taking the consent and thanking the patient, all three will come under the affective domain, whereas this use of correct tool assessment and performance comes under the psychomotor skill assessment. So this way you can assess both psychomotor as well as affective domains. Similarly for OSCE, in Dravya Guna and all, weighing the 5 grams of drug sample is the materials required, appreciate the organoleptic characteristics. So like this, you can go for different types of stations and you can assess the student. So again, here performing specific gravity, these are the checklist you can make. Accordingly, you can give the mark. So it becomes more and more objective in nature. And the last component that we come across is the viva voce. This we also know that this representation illustration is to see that this is how many a times the teachers or the examiners also feel while asking questions and getting the answers from the students. And at the same time, students' answers are also will be very funny while answering the questions. So to remove this type of subjectivity also, it is better we go for viva. So here, viva is an examination process consisting of dialogues with the examiner who asks questions to which the candidate must reply. It is a simple definition given for the term viva. So here, in viva was in health professional assessment, what are the things that we have to keep in mind? So what we should assess? We should assess the knowledge of depth. Okay, whether subject grasp and whether he is able to recall. So that component also has to be assessed. Evaluation of clinical reasoning and application. Here reasoning and application, again, it is what do you call as? It is again related to the cognitive, higher levels of cognitive domain. So theoretical knowledge, decision making, diagnosis, such type of things. We should also try to assess the communication. What is the communication skill? Because this gives us the importance about affective domain as such. And most importantly, professionalism, attitude, and ethical awareness of the student has to be observed or assessed. Critical thinking and flexibility, whether the student is able to critically think by himself or whether he is whether he is flexible to adapt to the situation, that has to be also to be assessed. And interactive assessment with feedback opportunity is always important. Well, specifically when you are conducting a summative assessment in term examinations, immediately you give the feedback so that the student will correct himself for the next examination as such. So that can be given. And holistic competency evaluation. So it should complement his written and practical clinical skills. It has to be complemented. So this is what we have to look into as such. We have to look at the professional conduct of the person, decision, we have to assess decision making skills, communication skills, analytical skills, confidence and composure, conceptual and application knowledge, and clinical reasoning and critical thinking. These things you should try to assess in viva. So these are traditional viva. Normally it is examiner bias, it is subjective. One examiner might ask only one question for one student, other student you might ask three questions. If he is having any student who belongs to his colleague, then you might not ask questions. So all these things will happen in traditional viva. So it will be prejudice in nature. Whereas in objective viva, so it can be done for both formative and summative assessment. You can do that. It is objective in nature. It is structured. It is non-biased, and clearly defined intellectual levels can be assessed. It is consistent in nature, and it is based on the criteria you can ask the questions, and there will be always scope for immediate feedback, specifically in internal assessment viva. For this, you can adopt something called a structured viva card. So you can get that questions from each topic with varying difficulty among the learning objectives. See, you should see the learning objectives. You should go back to the curriculum, and in the learning objective, they have mentioned assessment tools. In that assessment tools, they have given viva as one examples of different assessment tools. In that blueprint, whichever for objective they have asked viva, you should try to ask questions from that particular objectives only. So that has to be followed. If you follow that blueprint, it becomes easier for you to prepare a structured viva card. So a large series of colored Viva cards or questions with graded difficulty can be prepared. Graded difficulty in the sense recall level, interpretation level, decision making level, critical analysis level, like that different levels you can prepare. Then the question should be carefully worded, and you can divide the cards into groups. You can display the cards on the table. Candidate will come, you will randomly select one card, because all the questions that you have asked from this structured Viva cards are fulfilling your objectives. So therefore, it is essential for student to read those objectives, and he has to fulfill those objectives. If he has not fulfilled that objective, that shows that the student might have not studied that topic. That is one option, or it might not be taught by the faculty also. So that is one more thing. So examiner reads the question mentioned in the card. Valuation will based on the pre-prepared rating scale. Equal time will be given for each examiner. So what will happen? Each examiner should take a equal time. If it is 10 minutes, means examiner 1 should take 5 minutes, examiner 2 should take 5 minutes. And examiner individual marking, and it is averaged at the end. So this you have to prepare. So even we can see that our NCSM has given in blueprint, they have given from viva OSCE has to be asked from which particular content or topic also. It is clearly given. So here, for example, in Dravya Guna, so they are given 10 minutes per student. Try to limit yourself each student for 10 minutes so that you can finish 20 students in a day. So that can be done. And next, fundamentals. These are the topics from which you have to ask marks. 3 questions, 15 marks, each question carrying 5 marks. So you can ask from these topics only. Karma, Dashemani, Mishaka, 3 questions, 15 marks. So what will happen? You can also see that at last there is something called as communication skills for 4 marks. So that also has to be assessed. So this is an example I have just quoted. Classify Udvida Dravya and state one example. So this is at the recall level. Explain the importance of Abhyasa Guna in the Chikitsa. This is again at the recall as well as the interpretation level. Mention Panchabhatikatva of Shadrasa, again at recall level. Analyze the importance of Grahi Karma, that is again at the critical thinking level or analysis level. Enumerate, these are all come under the recall level. Define pharmacodynamics comes under the recall level. Explain the conventional treatment modalities of bronchial asthma, again interpretation level. And again, this is analysis level. A person comes to your clinic of increased body temperature, recommend any 2 ideal drugs with reasoning. So it is reasoning level. So like this, you can prepare a structured Viva card, and then you can prepare a rating scale for them, and then you can ask the question. So whenever doing Viva, always use the clear questions, be objective, give equal time to all students, and always examiners, we should be professional and attentive to the answers that the students give. Try to avoid irrelevant or tricky questions. Okay. So, and always never be biased in your examination. We should avoid prejudice and subjectivity, and we should avoid comparing students. We should not tell that student was good, the student is bad. We should not do that. Intimidation and disinterest. We should not create intimidation, and also we should not show disinterest. And over prompt and selectivity should also not be there. So these are the things that we should try to follow while conducting the Viva. With this, at the end of this session, we were able to try to fulfill all these objectives. I'm open for questions, and thank you. Am I
Thank you
audible?
so much, sir. Thank
Yeah.
you for the wonderful presentation. It was a very interactive session, it feels. We are having a lot of queries in chat box also.
Yeah.
Further, if anyone is having any query, you may raise your hand, and I will be unmuting you for the queries. Dr. Rupali, you can unmute yourself and raise your query. Dr. Rupali. Dr. Rupali. Dr. Sanjay Prakash. You can unmute yourself and raise your query. Dr. Sanjay Prakash. Dr. Sanjay Prakash. Dr. Rajkumar Gupta.
Hello.
Yes, sir.
Sir, there is one point
Sir, your
that
network is
COPO
not stable,
mapping
it feels. Can you close your video and
and
speak?
COPO mapping is done from where? How COPO mapping is done?
Sir, I'm not able to hear
And
you
what is the
properly,
role
sir.
of question paper?
Which
Hello?
question? Theory-based question paper, sir. Theory-based question paper is always used to assess the cognitive domain skills, cognitive domain. So recall domain and reasoning domain, analytical
Yes.
thinking domain. Yeah. Whereas practicals is related to psychomotor and affective
So
domain.
for COPO mapping, we need to
I'm not able to hear you, sir.
Sir,
Can
your
you?
network is not stable. Kindly close your video and speak. So it will be requiring less network there. You can close your video and speak.
okay.
Repeat your
Now
query,
am I
sir.
audible?
You are audible. Repeat your query.
Sir, there is one point that COPO mapping, and I think COPO mapping is done on the basis of question papers. We ask in say for terminal exam or final university exam.
Yes, sir.
So
That,
how to do COPO mapping?
sir, this
And
is
see,
again.
I have seen one question paper. Because I have prepared one question paper for DY Patil Nerul, and
Okay.
in that question paper there was a CO and Bloom's taxonomy level was written there.
Yes, sir. Yes,
But
sir.
most of the colleges still not doing that. But
Normally
I
it is
think
not
all the
done, sir.
colleges.
But as per the norms of education methodology, your question paper should always consider the question should reflect whether it belongs to recall or whether it belongs to analysis. That has to be done. So that mapping, we can see that when we specifically when we do for QCI and NCSM norms, there it is specifically asked. When you're preparing a question paper, that mapping has to be done. If you frame, for example, if you tell that define dravya, so in the bracket, you should write whether it is domains is whether it is recall or whether it is cognitive recall or whether it is cognitive knowing, or that has to be clearly mentioned. Yes, that has to be mentioned, but many of the universities are not following it right now.
Yes, sir, correctly. If you start practicing this, the student will be able to know that this question is checking which level of learning domain.
Yes, sir. If you mention in the question
So I
paper
think
itself,
it is a good practice if you already print the CO and the Bloom's taxonomy level in question
absolutely,
paper
sir.
itself.
Yes, I do agree with your point, sir. It because students themselves also will come to know at which level they are answering as such. It would be always better, but however, it depends
Yes,
from
sir.
the university to consider these aspects.
Thank you so
Thank
much,
you, sir.
sir. Next query, Dr. Sriram Chandra Mishra. You can unmute yourself, sir.
Namaskar, sir.
Sir, I think you have opened in two systems. You have to,
Yes, sir, I close one.
please
Sir,
repeat.
my question is, sir, we follow your all guidelines, but the university question pattern is different. Students query that if NCSM asks that this topic contains a maximum 24 marks, how this much questions came in university exams? Whether there is any grace provision for them?
Sir, actually, the university, the people who set the question papers in university, they should be aware of this particular curriculum blueprint. If they're having the blueprint, if they follow the blueprint, there won't be any sort of confusions while framing the question paper. If they don't follow the blueprint, there is all chances that there will be confusion between the students as well as the faculties. We have come
Sir.
across this issue in with our students also, sir. Questions being changed after some time. So this happens, but while setting up the question paper, if we have blueprint in our hand and then based on that, if we set, then it shouldn't be a problem.
Sir, just instruct the initiation must instruct the universities to give a blueprint also when they ask for questions for any person. University also instruct them.
University should instruct, and also the question paper setter should carry a blueprint with them, sir.
Yes, sir. Yes, sir.
We have
Yes.
taken note on this. We will do the accordance in the same. Further, in previous years also, we have received few complaints where universities were not following blueprinting, and we got requested from student, and on the same, university has given extra marks for those questions, those who were different from the blueprinting which we have provided. So accordingly, we work. You may send us query that university has done this mistake, so we can do the work accordingly.
Okay, sir. Okay. Thank you.
Thank you, sir. Dr. Sri Vidya.
It was a very nice presentation. Thank you so much for this excellent presentation. I have one question that is regarding the matching that you have mentioned in the
Yeah.
MCQs.
Yeah.
So I feel whether it will be overwhelming for the student because it will take more time because the matching itself has got 4 sub points. So
Yes.
whether it will take more time than usual to solve another typical MCQ.
Absolutely, I do agree with it. So that is the reason why I told you can adopt such type of MCQs in your formative or internal assessments. So you'll get little bit time as such. There you can try to adopt it. So it becomes why? Because the same question will be asked to everyone. So answer that you get will be similar type of answers. So marks given also allotted also will be easy for you. So that of course it does take time, but we can see that even nowadays, even in school examinations, they're asking such type of true or false and MCQ questions. So that is again related to the education policies related as such. It again depends upon the teacher or the faculty to decide what type of questions they can ask. Because what will happen is that you can assess many things in one question. So that is one advantage of going for match the following questions. Of course, it might take time, but at recall level, I think definitely you can do for matching type. And your university should accept in your final examinations. Normally, many of the universities will accept only A type questions. So I just gave you the other options also for you people so that you can adopt wherever necessary.
Thank you, sir. Dr. Tanisha.
Hello, sir. Hello.
Yes,
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 ma'am,
ma'am.
you are audible.
Yes.
Sir. Very nicely explained today's lecture. I have one question that for non-clinical subject like Dravyagun, how to assess OSCE and DOPS? And second question in Dravyagun topic 1, there is a defined Dravyagun Vigyan. It has
Yes.
allotted 1 mark.
Yes.
And in table G3, where
Yeah.
they give the assessment guideline, there is written only P viva. So we have to ask it is for MCQ or in practical.
Yes, madam. Since it is 1 mark, first I'll answer the first question that is related to define Dravya Guna. So that has to be asked in MCQ only. So something like you can make it something like a fill up the flags definition of Dravya Guna. It includes, okay, whether Dravya Guna Karma dash is Dravya Guna Shastra. So the options you can give Prayoga, Vividastata or other options and they will answer the first question. So it becomes under the MCQ type of question since it is a 1 mark. And I'm not able to get your second question, ma'am. Can you repeat it? Hello? Hello?
Dr.
Hello.
Tanisha.
Hello.
Yes.
Yes, ma'am.
सर उधर एमसीक्यू पूछना है या प्रैक्टिकल में उसको पूछना है, ये मेरा क्वेश्चन था.
कौन सा
इन
क्वेश्चन है मैडम?
फॉर टॉपिक 1 ना, देयर इन असेसमेंट टेबल G3
हाँ
There they
अगर
given guideline as P viva. So we have to
हाँ,
follow that inscription, or we have to ask the question in written MCQ.
yes, if they have
If
given
it
P
is
viva, if they have given P viva and MCQ both, in theory you can ask. Theory you can ask as an MCQ.
there is
In
only P viva, ma'am.
then you can ask it in viva, madam.
There
In
is written.
viva you can
Okay.
ask.
Okay, sir. And the second question for non-clinical subject like Dravya Gun,
Ah.
how to assess OSCE and DOPS?
Madam, OSCE is specifically, as it is clearly mentioned, it is objectively structured clinical examinations. So normally we don't involve in OSCE. For us, OSPE will be applicable. OSCE will not be applicable for non-clinical subjects like Dravya Guna. However, during the formative assessments, if you want to do, you can get it done, madam. But for our Dravya Guna subjects, it is the DOP or OSPE. The DOP
Oh,
and OSPE are similar, but OSPE is more structured in nature compared to DOPs.
okay. So DOP is also not done by Dravya Gun
No, we
subject.
can do DOP of practical skills, no, whether they're performing, whether
Okay.
they're able to do the bulk density experiment, whether they're able to
Okay.
do the cross-sectioning of the stem. So this comes
Okay,
under
sir.
this one.
Okay, sir. Thank
That
you.
we can.
Thank you very much, sir.
Yeah, madam.
Vaidya Charushila.
Hello, sir. It was a very informative session. My doubt is that we have so many of TAs in each term.
You are not audible, ma'am.
We have
Ma'am, you are not audible.
hello. Hello, am I audible?
Dr. Naveen.
Yes. It's myself.
Okay.
Uh,
Dr. Srividya, she is again here.
Sir, again, I have one question that is regarding the impact classification that you have done, no?
Madam,
Impact classification.
you don't worry about the impact classification. NCSM has already given us a blueprint, so
Okay.
you need not worry. But when
So,
you are doing it for formative assessment, because the syllabus will be very less, syllabus portions will be there. For that, you can decide based on the topic, you can decide what is the impact. Otherwise, for final exam, blueprint is already there. You need not worry about the impact and the frequency of the questions.
Thank you so much, sir. And I think here we end question answer session for our last session of faculty development program.
Can I
And
take a minute?
sure, sir, sure.
Okay. I would like to again thank all the office bearers of NCISM for giving me this opportunity, and also I would like to acknowledge my mentor and guide, Dr. Munir Ahmed sir, who is a pioneer in education methodology. It is because of him I could able to convey some information to all the faculty members who are present here, and also like to thank all the faculty members who are present here for your patience listening. Thank you one and all.
Thank you so much, sir. Now we have Dr. Atul Babu Varshney with us. I request you, sir, to conclude the meeting with vote of thanks.
थैंक यू डॉक्टर शुभम। यहाँ उपस्थित हमारे चेयरमैन मैडम मनीषा जी, हमारे दोनों बोर्ड के प्रेसिडेंट अलम प्रभु गुड्डा जी और असीम अली खान सर, सभी वक्ता जिन्होंने ये 3 दिनों में सारी अपना लेक्चर दिया है, और सभी उपस्थित फैकल्टी, आप सबका बहुत आभार व्यक्त करता हूं, जो आप सब लोगों ने आज भी लगभग मैं देख रहा हूं 500 लोग जुड़े हुए हैं, 3 दिन से लगातार सारे कार्यक्रम को देखा है। मैं सब सर पर अपना आभार व्यक्त करना चाहूँगा हमारे पूर्व चेयरमैन डॉक्टर बी.एस. वैद्य जयंत देव पुजारी जी, हमारे पूर्व अध्यक्ष बी.एस. प्रसाद जी, और हमारे BUSS के पूर्व अध्यक्ष जगन्नाथ जी को भी, जिन्होंने बहुत मेहनत से 4 साल इस पे काम करते हुए हमारा सिलेबस बनवाया, और इस सिलेबस में जितने लोग भी जुड़े, बहुत मेहनत की गई थी। तीनों बैच के सिलेबस में, तीनों प्रॉप के सिलेबस में। तो मैं इस अवसर पर उन सब लोगों को भी धन्यवाद देना चाहूँगा और हमारी सभी फैकल्टी को धन्यवाद देना चाहूँगा जिन्होंने बहुत मेहनत से इन पिछले वर्षों में इस पे काम किया, लगातार पढ़ाया और अब जो भी उनकी समस्याएं आई उनको खुल के बताया। हम लोग लगातार इस प्रक्रिया में रहे हैं कि जो फीडबैक मिलता है उसके आधार पे सुधार भी करते हैं। जैसे अभी फर्स्ट प्रॉप के फीडबैक मंगाए हैं, उसमें सुधार होगा। तो सभी लोग जो भी आज के कार्यक्रम में जुड़े हैं और जिन लोगों जो वक्ता रहे हैं, प्रदीप जी और नवीन जी, इनके साथ मैं सभी लोगों को हार्दिक धन्यवाद देना चाहूँगा, आभार प्रकट करना चाहूँगा। धन्यवाद। शुभम।
Thank you, sir. From NCISM, we thank everyone who has joined here. Special thanks to Dr. Anand Katti sir, Dr. Ashutosh Pathak sir, Dr. Sunil Tripathi sir, Dr. Pradna Kapse ma'am, and all the presenters who were there with us from all 3 days. A special thanks to Dr. Hema. She was organizing all the things from back end. I thank everyone whoever joined this meeting and made it to a great success. Thank you all. Thank you so much. We are ending our meeting here. Thank you all.